And the recording is now in progress. We welcome you, Don. Invite you to take over. Go ahead.
Thank you. Thank you. First slide, please. I'm so glad that you're here. Thank you so much for being here. And I want to first of all thank you for your compassion, because you already have a ton of compassion just being in the work that you're in. So next slide. We're going to do a couple things today. First of all, I do want it to be a thank you to you for all the work you're doing and for your amazing compassionate work. I worked in the Fraser Health palliative care and spiritual care for 4.5 years before transitioning into an educator and over to emergency. And so I know a lot of people from the palliative care and Fraser Health, and the compassion is incredible, amazing. And so I'm excited about today. And so it's certainly not about the next slide, please. It's certainly not about teaching something that you don't know already. It's not about some competency that you don't already have. But it's to help us to reflect upon some of the new science of compassion, to understand maybe the processes in ourselves and in others, and that might help us to grow in our compassion, and just to learn a few new things. So I'd like to start out by acknowledging that compassion is like a candle. You know, it's not a zero-sum game. If we use up our compassion, then it's done. But as we share compassion, it actually multiplies. And you're doing that already. Your candle is already lighting up so many other people's candles. So I'd like to start by just taking a couple moments to ground ourselves and to take a deep breath. Feel your body sink from your mind and the buzzing around that's going in there, including for myself. And get in touch with your body. Our bodies can so easily be in the past or in the future. Our minds can be in the past or the future, but our bodies are always in the present. And the more, if we approach things and we're calm and we are take a moment, then studies have been shown, we know that we learn more, we connect more, and we're actually more creative if we take that time to just calm and center ourselves. There is no other place you should be right now. This is the place for you. Next slide, please. So yeah, Melody mentioned that I was privileged to be a part of the CARES Center training, applied compassion training, which was an amazing training. And they have been on the forefront of research into how our bodies and our minds experience compassion and how it affects our compassion. So it was a great privilege to do that. Next slide, please. So all of you know the importance of compassion. Patients affirm that human interactions are the most important to them when in patient experience. So when they survey patients and residents that come from facilities and ask what about their experience, then studies have shown that people, first thing they comment about is how they were treated. They'll comment about how they were treated by the healthcare providers that they encountered. That more than wait times, more than the actual procedure that they had, it's the encounter that really leaves the biggest impact. And I think I broke my back, my own experience. I broke my back over 10 years ago, and it was long before I was involved in healthcare at all. And but from my getting into the hospital through emergency and then moving through a couple of different wards and units, and after ending up there for 5 or 6 days, I quickly kind of realized that there were so many people coming and going in my care, and there was those that really saw me, and I felt their compassion and their presence, and there was many others that came and went, and I felt like I wasn't even seen, and it wasn't even cared for. I wasn't even noticed. And so that was my experience. I kept a journal. I started keeping a journal, and sometimes it was just somebody that came in incidentally for a few seconds, and I would comment, that person saw me, and I experienced that connection with them. And then others would come in for more lengthy procedures or counsel, and I would feel like, well, that person didn't even notice, didn't even really connect with me at all. So so we all know that compassion makes a huge difference. Next slide, please. So the purpose of compassion training is again, it isn't to teach you something you don't already know, especially within healthcare. That's, the reason why you're in healthcare is because you're compassionate people, I'm sure. But it's to create the internal and external conditions for compassion to really flourish. And by providing training and experiential experiences in a number of different ways. There's a growing body of research that suggests that the practice of compassion increases happiness, and that training individuals in altruistic behavior enables emotional regulation and results in emotional rewards, such as increased satisfaction in our work. Next slide, please. There was a study that just came out a couple months ago, and it was of 4,501 emergency patients, actually in Calgary, Alberta, and as they kind of evaluated the situation, and the conclusion was that compassion was identified as a key contributor to emergency department overall quality care ratings. Patient-reported compassion is an indicator of quality care, and it should be formally integrated into clinical care assessments. It was clear that was a huge impact. The compassion had a huge impact on people's experience in the emergency, which of course isn't a surprise for us. And for you in palliative, I mean, even more so, how compassion can make a difference for people that are nearing the end of life or in the midst of their life-defining illness. So next slide, please. So when you hear compassion, the word compassion, what do you think of? So feel free to come off mute and just name some words or put them in the chat. When you think of the word compassion, what word associations come forward for you?
Being a human with a human.
Nice. Yeah, thank you.
Applying action to empathy.
There's somebody who knows something about compassion and empathy. Thank you. Shared experience and meaning. Thank you. Slowing down. A few more. When you think of the word compassion, what other words come to mind? Let's see the chat.
In the chat, Cindy has noted patience and gentleness. Jody says shared experience of meaning. Jess notes slowing down.
Thank you.
Putting oneself aside and tending to others.
Well, next slide. Thank you. So let's break it down a little bit. A lot of people will use different words for compassion, and there's many different expressions of compassion. But it helps us to break it apart a bit and to parse out the differences. People will often interchange sympathy, empathy, and compassion. And so if we break it down, then sympathy is more of a pity-based response. It's sort of distancing and self-protecting, and it is noticing somebody's suffering and acknowledging it in some ways, but usually it's from a distance, or maybe even looking down on somebody suffering or being judgmental or something. And people generally don't want some sympathy. Empathy is a genuine, caring, connecting to someone's humanity, and it's essential, and it's connecting a part of who we are. But it stops there. And compassion is an activated response to someone suffering through truly seeing, connecting, and choosing to respond. It's interesting, evidence is showing that on behalf of the caregiver, for us caregivers, sympathy leaves us feeling disconnected. Empathy can be very tiring and draining, leading to depression and burnout. But compassion is actually energizing for the caregiver and the receiver. Next slide, please. So empathy. So empathy is really coming alongside. I'm really sorry. I'm glad that you told me this. It must be hard. My heart breaks with you. Empathy is allowing ourselves and trying to understand the other's emotions and experience. We instinctively feel what other people feel to some degree, and we have a response to that experience. It's an internal response experience. So the research on in the neurobiology of empathy has changed the perception of empathy from a soft skill to a neurobiologically based competency. So it's not just psychologically or spiritually or in our imagination, but it's a biological reality that we experience other people's experiences. We actually do feel the pain of others. If I were to, if I was sitting here in my room and a colleague came in and they had just cut their arm, this giant paper cut on their forearm or something, and they came in and they were bleeding in front of me, as I would begin to notice what happened, I was registering what was going on, seeing the anguish in my colleague's face, and then seeing the blood and the cut, then my body would start responding to the pain in a similar way to her body is responding. In fact, my brain will start firing in the very same place that her brain is firing because of the pain. Our empathy is a neurobiological competency, a hardwired skill that has enabled us to survive as a species. Our offspring are incredibly vulnerable for a long time. And so biologically, we've evolved to actually feel and to empathize with each other. And when we're empathizing with somebody's pain, then that's a stress response. And we're actually feeling somebody's pain. So if you think about it, how many times in a day in your work are you experiencing somebody else's pain or suffering? So it's as you're entering into those people's experiences, you're actually experiencing pain and suffering in your own body, in your brain, and in your mind. It's a pain response. So it's really important. It's really, really important for us that we do have empathy. It's a biological reality, but it hurts. Next slide, please. Compassion is when our empathy triggers an active response towards the other person of some kind. It's an engagement when we turn our experience of the other person's suffering into doing something about it. In an article entitled Empathy and Compassion by Tanya Singer and others says, exposure to the distress and suffering of others can lead to two different emotional reactions. Empathetic distress on the one hand results in negative feelings and is associated with withdrawal. When experienced chronically, empathetic distress most likely gives rise to negative health outcomes. On the other hand, compassionate responses are based on positive, other-oriented feelings and the activation of pro-social motivation behavior. So we've all heard the term compassion fatigue, and the fact that if we enter into people's suffering too much, then we can experience compassion fatigue, and that's a reality. But we're changing the nomenclature of it. That it's actually not compassion that's fatiguing; it's empathy. It's being stuck in our empathy, and that when that empathy is turned into compassion, it changes things. So instead of the term compassion fatigue, researchers and scholars are using empathetic distress, being stuck in empathetic distress. Next slide, please. Richard Davidson in his book says, the brain networks associated with compassion and empathy don't overlap at all. They are completely different systems in the brain. When people experience raw empathy, brain regions associated with pain and negative emotions become active. But with compassion, it's different. It's a different network. It's brain regions associated with positive emotions, feelings of connection, and the ability to see from somebody else's perspective. So empathy with suffering starts as a stress response in our amygdala and the primal part of our brain that responds to threats and to recognition. But then that's where it stays. Next slide, please. When compassion is at work, the insula, the amygdala, and the temporal parietal junction and the prefrontal cortex are all activated. In addition, so these are the more evolved parts of our brains. In addition to those parts of the brain, research suggests that there are also biological changes in the brain's pathways when compassion occurs. First, there's caregiver nurturance pathway in the hypothalamic midbrain, and there's the dopamine reward pathway. So they're very different experiences, the process, when we move from empathy to compassion. Another quote, not only so then there's also from the National Institute of Clinical Application of Behavioral Medicine says, there's dopamine comes into the picture, but also the role of oxytocin in compassion is to drive the urge to serve another's welfare, to be supportive. It's also to reward, because we experience the re-release of oxytocin as something rewarding. When we engage or interact with someone in a supportive way, we actually cause them and their bodies to release oxytocin. And so compassion causes us to release oxytocin and also the receiver of compassion. Next slide, please. So what characterizes compassion is that parts of the nervous system that can transform a kind of fight or flight stress response shift into what looks more like a caregiving or a courage response. So people, we often associate compassion primarily with kindness and with gentleness and with all those, which it is. But in our brain, in our system, in our experience, it's actually closer to a courage response. It helps us to see and understand. The helpful thing here, I think, is for us to see and understand what is going on within us. Next slide, please. So empathy is depleting, and it lights up the pain regions of the brain. Of course it is. If we're suffering with somebody else's suffering, then of course it's going to affect us like suffering does. But compassion is nourishing. It lights up the love regions of the brain and releases oxytocin and dopamine. I'll just pause there. Is there any quick comments, or I'm going to cover quite a bit here, but we're going to have lots of time for we're going to have time for discussion after. So, but anybody want to jump in with anything here?
Go ahead and unmute yourself if you want to just add a comment or question.
I'll keep going then, but jump in if you need to, feel the urge. So next slide, please. So compassion. So compassion, it inhibits fear and activates courage. It shifts the dynamics in the specific brain region so that we are better able to manage difficult emotions and tolerate distress. It enhances heart rate variability, which I didn't know anything about, but I guess good heart rate variability is very healthy, and so that's a good thing, and improves our mental health and pro-social function. I have more quotes about how it affects our bodies and minds. There's one that says, you can see that how the vagus nerves begin to talk to our heart in order to slow down kind of fight, flight, or heart response. And you can see it in the hormones that begin to circulate in your brain and your body. It contributes to interesting combination of being calm and grounded, yet centered, yet energized and ready to engage. The compassion is an amazing capacity, a process within us. And it shows that, of course, when people receive our compassion, they're affected. And the book Compassionomics, by an ICU physician and researcher, is a whole book about how evidence has shown that compassionate action towards patients and people that undergo procedures, they do better. They do better physically, they recover quicker, they need less medication, biologically, do better from this. Some of the studies are, they're one group is given a certain diagnosis and a certain situation by doctors and nurses, and then the other group is given it by the same, by doctors and nurses, but they're given an extra 10 or 15 minutes of compassionate engagement on a personal level. And then the results of those two, it's incredible the difference that little bit of compassion can make. So compassion affects the caregiver and the care receiver. The next slide, please. The Dalai Lama, and none of this is a surprise to us. The science is just, I think, showing what we already know. But the Dalai Lama said, if you want others to be happy, practice compassion. If you want to be happy, practice compassion. So it really is a powerful, powerful part of our experience. So let's go a little bit more deeply into what is compassion. Next slide, please. So what is compassion? I've got a couple of definitions. Compassion is a complex unfolding process in the mind, heart, and body that shapes our responses to suffering. Shane Sinclair, one of our Canadian spiritual health practitioners, researchers, says compassion is a virtuous response that seeks to address the suffering and needs of a person through relational understanding and action. Next slide, please. Oh, back one. Compassion always and only arises in response to suffering. And compassion is a distinct response to suffering that includes action to relieve it. So I've heard it, and they say the definition of compassion is love's response to suffering. So we have different responses to different people's experience. We have responses to joy. We have responses to surprise. But compassion is our response to suffering. But wait, we don't like compassion always and only arises in response to suffering. Biologically and neurologically, the process only arises in response to suffering. But how many of us actually like suffering? Right? Don't we like to avoid suffering? I think that's probably, if you were to define, our dominant culture and media and a lot of kind of the way that we live our lives, kind of avoiding suffering would probably want to be one of the main themes that we live by, subconsciously and consciously, right? And this is one of the keys that when in the ACT course that I took, that really was an eye-opener for me. We all encounter suffering, ours and others. And it's as we turn towards it that it creates the opportunity for compassion to arise. If we turn away from suffering, if we avoid it or minimize it or try to problem solve it or just try to get over it, then compassion doesn't arise. Other things arise, like fear, tiredness, resistance, anxiety, stress, pain. It's as we turn towards the suffering that compassion arises. And that was really big for me to learn. So next slide. So what do I mean by suffering, right? A wide range of unpleasant subjective experiences, including physical and emotional pain, trauma, psychological distress, and existential anguish, and feelings of disconnection. And then one that came from the ACTS course, any moment of time when our experience is other than the way we would like it. And so thank you. And so suffering is when we are experiencing, something that we don't want to happen, whether it's experiencing it through somebody else's pain or in our own pain. And we can't skip this step. Yeah, so as we enter in, so if we push away and we're trying to avoid it, then that actually keeps us in our empathetic stress response. But actually we turn towards it, then that can begin the process of or the brain shift towards compassion. So again, what is compassion? Next slide, please. So the process of compassion is seeing the suffering, feeling the concern, empathy, experiencing connection to the person that is experiencing the suffering, and then doing something to lessen or to relieve the suffering. Feeling, responding, and doing something. So the first key is actually seeing it. And that's what we often don't do. We learn not to. And when we actually gloss over or pass by other people's suffering and our own suffering, then that prevents us from really experiencing compassion towards others or towards ourselves. But what is doing something? Well, I'm in spiritual care. And so in palliative care, as I was meeting with people that were at the different stages in a complex palliative care unit or in the hospice or at home, different stages, some at the very end of life, some are having great physical suffering, some, finding peace. What am I actually doing? I'm not actually physically helping anybody when I was entering in, but turning towards their suffering, being with them, wanting to do something. That is the shift. That sometimes just being there, just being present with somebody in their suffering is that shift that can activate compassion both in me and in the other person. For many of you, or maybe most of you who are doing physical things, you're caring for people, you're giving medication, you're consulting, you're doing tests, you're actually physically doing things in response to this person in front of you. Well, that's part of your compassion. But it's as you connect with their suffering and them as a human being that is more than just a task, more than just a job, more than just a burden. It's actually something that will be life-giving for you as you see them as a human being. There's a quote, observational data. This comes from the book Compassionomics. Observational data indicates that healthcare professionals who are able to maintain empathy for patients and consistently practice with compassion have less burnout, more resilience, and superior well-being, indicating that compassion may in fact be protective. Contrary to the classical thinking that investing oneself in patients is emotionally taxing and has a negative effect, i.e. empathetic distress, on healthcare providers, recent data suggests that compassion and human connection can promote long-term resilience and well-being for healthcare professionals. And it's a loop. It's a feedback loop of the patient or the person is feeling the results of compassion, and then also the giver of compassion. Yeah, let's keep going here. So that's the process of compassion. Next slide, please. So the science and the neuroscience says that empathy is good, but it's hard on us. But compassion is actually good for us. But it's all connected to suffering. So the next slide, please. So both for us and the other, our experience is profoundly affected by the way that we engage with suffering. I'll pause just for a minute. Any comments or questions that anybody would like to jump in?
Hello. I
I
mean, I could save this for the end too. And I so appreciate the distinction with empathy fatigue versus compassion fatigue, because like I look at compassion as an outlet for the empathy that we have. So how could we have that fatigue after. So I so appreciate that. And then the other piece is, and I'm sorry, I've had a cold, so my brain is so foggy and I've totally forgotten my second part. So I wanted to acknowledge what I'm learning. Thank you very much.
Yeah, that's powerful for us to realize, isn't it? What the processes that are actually biologically happening in us. It's not just, our minds. It's not just psychological. It's actually biologically our bodies are responding to people's suffering, and the way that we respond to it will affect us. Um, so, so I want to turn the next few minutes into self-compassion, because that is a really key component of discovering what turning towards suffering means. Because often caregivers are really, really good at turning towards other people's suffering and having compassion on others, but not very good at having compassion on ourselves. And so self-compassion is a really interesting thing. And when I first heard about self-compassion, the kind of self-compassion movement, I was quite skeptical. I mean, just think positive, have glowing thoughts about yourself. Just stay positive and everything will be okay. Be nicer to yourself. And that just seems so petty. And especially in the context of palliative care and of in the emergency, it's not. But it's so much more than that. So the next slide, please. Self-compassion involves being open to and moved by one's own suffering, experiencing feelings of caring and kindness towards oneself, taking an understanding, non-judgmental attitude towards one's inadequacies and failures, and recognition that one's own experience is part of a common human experience. And so it's super important that we need to have self-compassion. So just quickly, self-compassion is kindness to yourself, treating yourself it's with kindness rather than judgment, treating yourself as you would treat somebody that you love. Common humanity versus isolation, recognizing that you are imperfect and you suffer like everyone else, but that's what makes you, that's what the same, you have it in common with everybody. And awareness, mindfulness over identification, being with your suffering instead of being consumed by our suffering. Next slide, please. And there could be obviously a whole week on self-compassion. So this is just to engender some more conversation. So the process of self-compassion, and I'm sure many of you are familiar with research and the concept of self-compassion, but is recognizing and accepting our own suffering. And that it sounds maybe obvious, but can be really hard. We often don't actually stop and allow ourselves to feel and to recognize our own suffering. We minimize, we turn it away. At the beginning of the course, when we were doing some exercises, and they said, look at your own suffering. I work in palliative care. Compared to everybody else around, dying people, I'm not suffering. It's just a mechanism, right, of avoiding our own pain and our own suffering. So we accept ourselves. We allow ourselves to feel our own suffering and empathize with ourselves, and then treating ourselves like the way we would treat somebody else. What self-compassion isn't. It's not weakness, a sign of weakness. It's actually a source of great strength. It's also not laziness. Sometimes if I'm too easy on myself, then I'll just slack off, right? No. That motivation that I have to be hard on myself to do something, that will last for a little while, but ultimately that won't be healthy and it won't last. But it's letting ourselves off the hook, but it's not laziness. It's not letting ourselves off the hook. It's actually engaging ourselves, and it's not selfish. Treating ourselves like we treat and we'd care other people is not being self-absorbed. It's actually being self-aware and being able to give ourselves more. So next slide, please. One of the super interesting things about self-compassion is that we have a genetic disposition against it. Next slide, please. We have a negativity bias. And a negativity bias is a form of cognitive bias, and this has been studied over and over again. There's an asymmetry that occurs when we process negative and positive information in an attempt to make ourselves sense of our environment. Specifically, we attempt to learn from and use negative information more than we use positive information. So self-compassion is intentionally countering an evolutionary disposition that we have that is a biological reality for us. So our hardness on ourselves, our tendency to judge ourselves and to minimize ourselves and to see the negative, that's a cultural thing, I think, but it's also a biological reality because we have learned to protect ourselves. Our negativity bias causes, it's an innate tendency to look for danger. And that's part of our evolution. We look for danger and we hold off against threats. And so we tend to, so that's why we can actually, biologically, it's easier for us to have compassion towards someone else. And it's somebody that we're nurturing, somebody that is vulnerable, somebody that we want to survive. But then for us, for ourselves, we're more protective. Next slide, please. So the negativity bias that we have biologically, neurobiologically, it helps us survive. Our brain learned to seek out information that signaled danger. And so because we haven't evolved, so our brains are still functioning as if there's, a saber-toothed tiger around the next tree. And so our brains respond to threats, psychological threats against our identity, threats against, that when we feel anxious, those are biologically we respond to those things as if our life is in danger. And so our negativity bias and our biological response is actually stronger than our compassion response. And so that's why it's harder for us to be compassionate towards ourselves. And so that's where self-compassion, it's an actual hacking of our biological functioning and to learn to be compassionate towards ourselves. Next slide, please. So how do we do that? Well, these are some of the effects of self-compassion. Again, oxytocin and dopamine opens up our perception and promotes resilience and emotional connection with others. Next slide, please. Empathy is a biological response to pain. Oh yeah, so here I missed something here. Yeah, sorry, I thought there was another slide. So can we go back to the other slide? So self-compassion, the effects of self-compassion. So we can hack our biological system by being compassionate towards ourselves as if we're being compassionate towards somebody else. Imagining how we would respond to a friend who is in the same distress or situation that we're in, and then turning that towards ourselves. Again, neurobiological studies and all these things show that when we imagine an experience, that has a similar biological experience to when we actually do experience something. When we walk in, another example, when we walk into a forest, neurobiologically and physiologically, we experience certain things that happen to us if we walk into a peaceful environment. That it's a biological reality. Well, if we stop and we imagine and use our imagination and visualize a forest, then many of those same biological effects will occur. And so in the process of self-compassion, how do we learn to be compassionate to ourselves? It's by seeing ourselves as a person, as a friend, as somebody we love, and allowing ourselves to respond in that way. So next slide. And just a little bit of a review. Empathy is a biological response towards pain of others, but we minimize our own pain. So if we turn towards our own suffering with compassion, with kindness, compassion will emerge. And I think a lot of us don't ever really spend the time and the space or have the courage to connect with ourselves and face our own suffering. And that will often leave us in our own empathetic distress and not having compassion towards ourselves. I've got a couple more slides that I'm just going to quickly go through. The next slide. And I really encourage you to, if you haven't already, look up self-compassion. There's lots of resources. There's meditations and visualizations. Kristen Neff is on the forefront of the research, and biologically and brain science of it, and mindfulness. It all comes together. And so the concepts of compassionate touch, when we touch ourselves, we actually, our bodies do respond in a similar way to being touched by others, using words of affirmation towards ourselves, and becoming aware of kind of the field, they call it the field of compassion, that there's compassion for ourselves, and that's a reality. Next slide. There's an exercise that you can do. You'll get the slides, I think, by PDF, I think. So feel free. There's many exercises that we can do to kind of activate our own compassion towards ourselves. And this is just a short one that I'll leave you with. I think that's about it. One more slide. I'll finish with a quote, and then we can open up for discussion. When your fear touches someone's pain, it becomes pity. When your love touches someone's pain, it becomes compassion. To train in compassion, then, is to know all beings are the same and suffer in similar ways, to honor all those who suffer, and to know that you are neither separate nor superior to anyone. And then there's a couple of slides with some resources. I think, next slide. There's some questions. Next slide. So there's a couple of resources, but I have more if anybody would like to contact me directly. So that was just a super quick overview, but please, any questions or comments or thoughts or additions?
So I invite anyone to just unmute themselves and have the opportunity to speak or ask a question.
No, I think I think it's not new to any of you, but I think knowing the nuances and the processes can be really reaffirming. And I also that the question of can compassion be trained? I mean, they're showing through mindfulness, and again, the idea of mindfulness, it's like, oh, that's kind of trendy, right? It's sit back and pretend nothing exists or whatever it is. But no, mindfulness is really key to connecting with who we are, connecting with our own suffering and other people's suffering, and to grow in compassion. So and people can grow for sure. So I see Cindy first, and then Francis. Yeah.
Can I just give an experience of using the imagination with the being with another person's suffering, using compassion, of being with clients that are able to describe the sensations of the suffering.
Mm-hmm.
And in the description of the sensation in that present moment, being able to see the change, that it changes.
Mm-hmm.
And it's the imagination that started the attention to being with, turning towards it rather than finding something to get rid of it. And in that imagination of describing, the size reduced,
Mm-hmm.
the fieriness with the color reduced, and that relief that we both were able to feel because of the and that was one of the strongest ways that I find being compassionate, being with another suffering and wanting to uh, have the same experience,
Mm.
and in their description allows us both to release. I
Yeah,
just
thank
wanted
you.
to share that.
That's so powerful. And as a spiritual health practitioner, like that's a lot of what we do. I do is being with people and helping, if possible, to articulate. And the research behind that is called affect labeling. And there's all sorts of research that's showing neurological, biological studies that if we are able to identify a feeling even without saying anything, we just, even in our minds, it changes our biology, it changes our experience of that. And then, if even more so, if we could say it, and even more so if we say it to somebody else, which is something we've all experienced, but the science is showing that there's actually, it's a biological reality too. So thank you, Francis. That's an awesome example. I think Stacy, but I think there was somebody else before Stacy. Okay.
Hi, Don.
Yes. Cindy,
It's
yes.
Cindy. Yeah, I did have a couple questions or
Mhm.
just some discussion I wanted to have, but thank you for the presentation. It's great. So two things I wanted to ask or talk about. So naturally, you meet people who just have a high compassion already, like they just naturally are inclined to be compassionate. Usually you will find them in palliative care or
Mhm.
some sort of care program. Not always. Believe me, I've met nurses and compassion is not high on their list. um, but do you think you can train people to? I think you can. I think some people just have a natural inclination towards it. In fact, I'm pretty sure they do. And some people don't. But can you train the ones that are not particularly inclined? Their first response would be, I don't have time, get over it. I can see you're in trouble, but whereas a compassionate person, the response would be completely different. The second thing I wanted to ask you about is, you know, um, say you see someone suffering and you empathize with them, and then your compassion kicks in and you want to do something, right, to
Mhm.
relieve their suffering, etc. And yet you can't.
Mhm.
So what do you do in that case? I'll give you an example. So yesterday morning, I'm walking my dog. It's very dark. I can see someone laying along the side of the sidewalk, and it's a homeless person. And so I go by and I go, "Are you okay? Is there anything I can do? Do you want a sandwich? Do you need some money for coffee?" And it was no, no, I'm okay. I'm okay. I'll be fine. So I couldn't complete. I mean, my natural compassion was to help. Tried to think of some ways to help. There was no. It was blocked. So
Mhm.
thoughts.
Yeah. Well, those are great thoughts. I think, there's moral injury and moral distress that we experience when we know we could do something but we can't do it. Like something could be done, but we can't do it,
Mhm.
or we're forced to do something that we know we shouldn't, but we have to, kind of thing. So that can cause moral distress and moral injury, which is definitely something that is something that's real and is kind of compassion is connected with that, but it's certainly something to address in a different way. And we do carry people suffering with us. I mean, I just think about how much suffering we see on the
Yeah.
media. I think that's a
Yeah.
real interesting. We see
For
so much
sure.
that we can't do anything about. So
Right.
what's
We're
that doing
inundated
to
with it.
us, right?
Yeah.
That's
Yeah.
doing something to us collectively, I
Yeah.
think.
Yeah.
So yeah, and as far as can it be trained? Well, I don't think we can't force people, and that's
Mhm.
that's the sad and the irony is that the ones that are already compassionate are the ones that that will be responsive to growing.
Mhm.
I mean, studies show that people who are agree to mindfulness training within a few weeks of mindfulness and what meta meditation, where you're imagining a kind interaction. They set up these studies and they do it in their imagination, that there is greater compassion shown even just after a few mindfulness sessions. And whether that's long term or not, that may, who knows? But
Okay.
yeah, so it can be trained for sure. And I think people are on a continuum for sure. There's the super compassionate people that can probably still become more, and there's people that maybe don't have compassion at all. I don't think there's anybody that has no compassion, but I think we can all grow it, but of course people need to be open to it. So, and there's lots of studies about how they're trying to train, and that's one of the things I'm working on. And how do we train? How do we make those opportunities available? And my capstone project for my Stanford was compassion competency training for the emergency staff at Surrey Memorial, where I'm working. And again, but the ironic part, the people that actually came are people that probably didn't need it as much as.
Right. Exactly.
So, yeah.
Interesting.
Stacey,
Yeah.
I think you're next.
I was smiling and shaking my head because I feel like Cindy's comment was really was a perfect introduction to sort of what I wanted to speak to or wanted to pick people's brains about in terms of their experience of working in healthcare and seeing somebody suffering and wanting to provide support or a solution, and just with our limited resources these days, not being able to. And from there, for myself, I can definitely acknowledge, we call it compassion fatigue and maybe it's empathy fatigue because we can't act. Like there's like certain things where, especially for palliative folks, where patients, for me, I work in acute care and I'm helping support people to get back home, either for end of life care or to hospice or, wherever it might be. And they say, I would really love to take my loved one home, but I just don't feel like we can manage it. And we say, well, this is what we can put in for home support. This is what we can put in. And there's not enough. And that's just the reality of the system. And sometimes that in itself for me is just so disheartening because you can completely understand why an 80-year-old spouse would have a hard time taking care of their 80-year-old loved one, and family isn't local and they can't afford to pay private 24-hour care supports, but it's those unanticipated care needs that we're think that they might need. They're not quite at end of life, so I can't put shift care nursing in. Like just those things for me that can just they just eat at you sometimes. They're hard, right? So I agree. I think everyone that's probably here today are people that already are working on their compassion, or they are compassionate folks already, and it's just hard sometimes in the system that we work in to be able to exercise that compassion and not just get stuck in just being empathetic.
Yeah. And I think I would recommend the book Compassionomics by Stephen Tresiak. He's on the, so he has a TED talk. I think he did a study and is very scientific based. And as a ICU doctor, he recognized that it took 45 seconds to be compassionate, and that 45 seconds that he took made a huge impact on his patients, but it also made a huge impact on him. And so they've done studies so sometimes that becomes an excuse. It's a reality, absolutely reality. But are we really connecting with people and turning towards their suffering, even in the slightest way? Or are we just dismissing and staying in this kind of distant empathy? But it's hard out there. Yeah. Oh, there. Thank you. Somebody put that. I love it when people do that. Thank you. So I think, we're out of time, but thank you, everybody. And I'm happy to respond to emails and do follow up with anybody. Yeah. Off and back to you, Melody.
Okay, thank you so much, Don, for this really great time to just self-reflect and to look at compassion, empathy, and sympathy, and be reminded of what it takes to be compassionate people. And I think to also take the reminder of compassion begins with ourselves. Thank you for the wonderful presentation and the dialogue. I just want to say you will be, as a registered person, be able to access this series, all of the echoes. But this specific one, you will receive an email with the PowerPoint and the recording if you wish to review it or share it with a colleague. And just be mindful that there are also other echoes in the training program coming up, and you can jump onto our website. We'll drop that in the chat box for you or in the email as well. Thank you so much for this informative time, and thank you for coming, and wish you all a really great day.
Thank you, everybody.
Take care.